the Senior FYI. Again this week, we're doing things a little differently. With me this week, I have Adrianne Sacco Maguire. She is one, and I don't even have to introduce her, but you know her as one of Revere's public health nurses, and she's also part of the Emergency Response Network. And she's been interacting with a lot of the residents of Revere, but in particular this week with a lot of Revere seniors. And what I've asked Adrianne to do is to come on and speak to some of our seniors and discuss, the restaurants have been opening. We've had some stores, major stores opening. And I'd like Adrianne to talk to our seniors about what that means for them, over 60 population. Adrianne, welcome.
Hi, Deb, and thanks for having me. Hello to our seniors. Today, obviously, I want to speak to you a little bit more about coronavirus and what we all need to do to keep ourselves healthy and safe, and just some general information, especially where now more and more stores and nail salons and restaurants are opening. We don't want people to get the false sense of security that this is all over, because it isn't. We're still in this for months to come. And there's things that we need to do, and there's things that we can do to keep ourselves safe. Short of having a vaccine, the best thing that we can do to keep ourselves healthy is wearing a mask. And the transmission, when you have a mask, both you and the people you're with, cuts down the chance of you getting the virus tremendously. Now, that means wearing your mask properly. That means over your nose and your mouth. I know it gets really hot, especially in the summer, but wear it the best you can. Go outside and take a little air break if you need to. But that's what we found over everything else right now that will keep you the safest. So that means, like myself, I get up in the morning, I go about my business at home, and as soon as I walk out my door, my mask is on. I wear my mask wherever I go, including taking a walk outside. And that's really what I'm recommending for, everybody else.
Adrianne, so, we go into a restaurant, we're wearing the mask. Now we take the mask off, we need to eat. Do we keep that mask on the entire time while we're not eating?
Well, again, you're going to see a lot of things when you go out. Still, your most protection is keeping that mask on as much as you can. If you have to get up from the table to use the restroom, your mask needs to go back on. You can only sit 6 people to a table. Hopefully those are people that you live with mostly anyway, so you've already been exposed to those people. But as much as you can keep your mask on, you still should.
I want to address another question, because this has been bothering me a lot. We are an over 60, you and I, we're in an over 60 population. Is it safe for us to be going to stores, to restaurants, to nail salons, to anywhere at this point? Based on the governor's recommendations, should we be going out?
So here's the thing. Our best way to prevent us getting sick is to prevent exposures. So it's not over. We should be still doing things like we did them before. We should still be limiting the people that we're with. We should still need to keep social distance from people, even with our masks on. We're in a population where people over 60, over 65 are at a higher risk. That's also the same population that has other health issues, including heart disease, asthma, kidney disease. So all of these health issues increase our risk. when you go grocery shopping, stock up. Don't go every day or every other day. You could probably get what you need every 2 weeks. I know, you know, myself being a senior, but my dad, I review this with him all the time. He feels like he's safe because he hasn't gotten it in this original cycle. And he should be okay to go outside into the stores every day. I explained to him that it isn't. He still needs to do what we've been preaching, and that is trying to stay at home. If you need to be outside, be outside. Take a walk on the beach or take a walk around the neighborhood. I still recommend you wearing a mask. That's what I do.
So I guess the next question would be, if you do get tested and it's negative, should somebody then feel comfortable to go back out? I mean, is this a false sense of security?
So because you've been tested negative today doesn't mean next week you can't be positive. So we need to be vigilant all the time until this is over. And this is over could mean all the way through the winter. So if you've been tested, it just means you don't have it when you were tested. I know of many people who have been tested multiple times because they've been exposed and they've been concerned about their exposure. The first thing is, if we're doing what we can to eliminate our exposure, we should be okay. That's the best way to keep us safe. But you are not safe a week from now if you tested negative today.
Adrienne, what is the best message you could give to the seniors, to their children who are adults, to the city? What's the best message you can give to them right now to keep them safe?
My best message is to follow the guidelines that we've been talking about since March. It is stay at home, continue to socially distance. If you need to be outside, wear a mask. Continue to do things like washing surfaces at least daily of things that have been touched a lot. Don't touch your eyes, your mouth, your nose. And don't think that you're safe and you can still go and hug your neighbor because you both have a mask on. We're still asking you to socially distance. We're doing this for you. We're trying to keep you healthy and safe. We've put a lot of things in place and we put them in pretty quickly when we saw our seniors getting sick. We're here for you. If you have any questions, call your doctors. If you have any concerns, any issues, any health questions, if staying at home is a hardship for you with food and stuff, we still have our food program. Call 311. We want to do as much as we possibly can for you, but we also want to keep you healthy.
Thank you very much, Adrienne. And I think your nurses are doing a great job. Public health is doing a great job. The emergency response team, the mayor, I think they're doing a great job trying to keep our seniors and our city healthy. Thank you so much. I know that Adrienne has personally yelled at me for trying to make me put my mask back on. So I thank you. And I want to say to our seniors out there, the resources are there. If you have questions, if you need help, we are here. So call us. We are here for you. So I just want to remind everybody, stay happy, stay healthy, have a great week.